video, I'm going to talk about the what do you call it, tongue diagnosis, TCM tongue diagnosis. So, and what is TCM? Traditional Chinese medicine, right? And in the TCM tongue diagnosis, we look at the tongue. So this is the tongue. Ooh, let me see how would I do this. How do I go to? I can't change it, unfortunately. But anyway, if you look at here, the tongue, so open the mouth and pull the tongue out. Right. So over the tips here, that's heart area. Over here, that's lung area. And both sides, we check liver and gallbladder. This is all the organs are in here. Stomach and spleen area here. So there's kidney over here, and bladder and intestine. This is on the root of the tongue. So basically, if we go to here, like you see, heart, lung, stomach, spleen, liver, and lower tummy over here, middle, upper. So the whole chest is in here. Okay, so this is go to the organs. If anything wrong over here, when we say wrong, anything happen on the tongue, and then we can tell which organ out of balance. Okay, the tongue should be flat. If anything go in a deep depression, and that's lack of energy, not enough blood flow. And you can see that some people have crack on the tongue in the middle. That indicate two things. Number one thing is, if it's in here, the stomach and spleen function problem, or the spine is not straight. Could be the spine problem too. Okay. Then we often see patients have covered with coating, a slight white coating. So you should be able to see the color, pink or red, on the tongue. But if you see the color, and if you look clearly, you see that we see through a very thin layer of white, and then under the white, you can see through the white, and under the white, it's clear one, and then you see the color underneath. If the coating, the clear coating, thin one, it becomes thicker and thicker, it becomes white and thick, and then you no longer, some part of the tongue, you're no longer able to see the color underneath. That is the problem. And we want to clear out the dampness and mucus and phlegm. So that white coating indicating dampness or mucus, phlegm. Okay, all this are very important, super important in treating, in our treatment to help our diagnosis, because when the coating all over the tongue, that means it cover all over the organs, and when the organs cover with coating, which is dampness, and it will affect the circulation. The circulation in the organs decrease and the function decrease. And when the function decrease, whatever they control, they won't control, arrange it very well. They won't manage the function very well. And you start to have symptoms. Right? Therefore, we are focusing on tongue diagnosis. This is part of our diagnosis. We do pulse as well, but this is super important. Right? So today we talk about the top of the tongue. Next time we'll talk about underneath the tongue. I'll have to prepare some picture and show you underneath the tongue. What can we tell? Now on the top of the tongue there are some bruise spot, like you can see some black spot, bruise. Okay, that indicate blood stagnation. Okay, with a lot of pain related to those as well. Okay, so you want a thin layer of coating, and you'll be able to see all the color. So a lot of people have, very thick. It can be you have normal color in here, but thick coating in here. You can see the color on the root of the tongue. And that's in the, we call lower jaw, the kidney, intestine. So you may have kidney problem, intestine, digestion problem. Okay, so those the life for today, and hopefully you like it, and give it a thumbs up, and please put a comment down there and let me know what you want me to talk about. I'll see you next time. Bye bye.